And what are we seeing in San Antonio in terms of RSV, flu, and other respiratory illnesses?
So right now, overall activity is low, but starting to increase, especially for RSV and influenza. We're starting to see increased cases of that, people presenting to the emergency department.
And why do you think that is right now?
So this is the time of year where we start to see the respiratory viruses pick up. Rhinovirus, flu, RSV. Fortunately, COVID remains low right now, but we expect that will increase later this winter as well.
And do you think it's the closed spaces too, like people at work going back indoors, stuff like that?
That's a great question. There's a number of factors that probably lead to this increasing this time of year. One thing is travel. People are traveling more. It's holiday seasons. There's large family get-togethers, people getting together in close settings. And then also with the colder weather, sometimes people are indoors more. And then also in the wintertime, the air is a little drier. The relative humidity decreases some, and it makes it a little easier to transmit some of these respiratory viruses.
And what can we do to make sure that we're staying healthy and that we're taking, and also if we can't go to the doctor, what over-the-counter medications can we be taking to help that?
Sure. So there's a number of things to do to stay healthy. The most helpful preventive tool is to get vaccinated. Make sure that you're doing the best you can to protect yourself. Good sleep hygiene, staying hydrated are always important, especially during the holidays where people may be overindulging in some saltier foods. And then using good hand hygiene, either with soap and water or carrying around an alcohol-based hand sanitizer if you're going to be traveling about. People that are at high risk for infections should consider wearing a mask if they're going to crowded indoor settings to reduce their risk of getting infections.
And in terms of over-the-counter, is it more, or what should we be looking at?
Oh,
exactly?
sure. Great question. Over-the-counter medicine, so people can use medicines to reduce fever if they don't have any contraindications or any reasons they can. So they're taking Tylenol or ibuprofen. Really staying hydrated is really important. People get behind really quickly when they're sick. And in colder weather, sometimes we don't sweat as much, so we don't think we're losing our volume status, our fluids, and so staying hydrated is really important.
And vaccinated as well. A lot of people think, oh, well, I didn't get sick last year, but this year could be different, right?
It could be different, and one of the concerns that's been raised by experts across the country, including here in Texas, is that a lot less people have been getting vaccinated over the last couple of years, which means there's a lot more susceptible people for infections, and so that increases the risk that there could be more transmission and more people with severe illness this year.
And for those who may have not gotten vaccinated yet, is it too late to get vaccinated?
It's not too late to get vaccinated, so please go do so. This is actually a great time to do it. It gives your immune system time to build up those antibodies before we reach the end of the year, where we have a lot more travel, a lot more holiday get-togethers, holiday parties, and people want to spend their time at those parties and with family rather than in urgent care or in the ED. So some people, even if they get vaccinated, may still get ill. And if they're at high risk for severe illness, so if they're older, they have chronic medical conditions, pregnant women are at higher risk, there are flu antivirals, there's medicine, there's an antiviral for COVID-19 as well, that are effective in blunting severe illness to help reduce their risk of ending up in the hospital. So don't forget that in addition to getting vaccinated, there's also antivirals or pills that can be taken if you're at high risk for complications.
And if someone gets sick, how immediately should they go call their doctor, or should they wait if they get sick?
I think the best step is first of all, everybody should assess their risk status for severe illness. If you're not sure, you can always talk to your doctor about that. There's quite a few people on that list. Again, older people, pregnant, diabetes. There's a lot of people with diabetes in the San Antonio area. So if you know that you're at higher risk and you get ill with a respiratory illness, the sooner you get started on antivirals, the better they work, especially if you can be started within 2 days, but really within 5 days for COVID, within 3 to 2 days for influenza is the best.
Anything else, sir?
I think that's most of it. I think we touched on it, yeah.
Okay, cool.
Yeah.
I don't know that you need it on camera, but Dr. Bowling often says if you want to get the COVID vaccine, you can get both of them at the same time.
Yeah, if you want to say it.
Oh, sure, yeah.
Go ahead.
Yeah, and another question people have, one of the, I think, big barriers for people getting vaccinated, frankly, is just convenience. Scheduling the appointment, going to get it. They're real easy to do now. You can get them from community-based pharmacies. You can get the flu and COVID vaccines at the same time. There's no problem with doing that. Your body is sophisticated enough to develop immune responses to both, and it saves you a lot of time.